Debilitating and deadly lung diseases such as COPD and lung cancer are difficult to treat but can be mostly prevented. Dr. Aleem Surani, a pulmonologist at Northern Nevada Health Systems in Reno, Nevada, tells us the types of patients who come to see him with these serious breathing issues.
The types of patients who come see me, kind of wide-ranging, actually. A lot of smoking-related lung disease. Smoking can entail a few things. It can entail progression to COPD and emphysema, chronic lung disease that way. Lung nodules, lung cancer, which is a very underdiagnosed, underappreciated subject. And then there's also a subset of patients who come to see me who suffer from things like asthma, chronic bronchitis, chronic lung disease.
Dr. Surani reveals whether lung damage can be reversed.
The issue, particularly with the lung, is that a lot of damage that's done to the lung, unfortunately, is irreversible. And in pulmonary medicine, unlike other forms and specialties in medicine, our goal is not to cure, our goal is to manage. And management is a few things. Management is medications, inhalers, but those things act really more as stopgaps and Band-Aid solutions. The primary thing that folks can do really is to maintain themselves, is to continue to exercise, continue to maintain their functional status, and then certainly behavioral changes, smoking being the largest one. I mean, no matter what you do from a medical perspective, you're not going to decline of lung function in terms of its rate unless the person quits smoking.
Dr. Surani outlines the causes and consequences of COPD and lung cancer.
In terms of COPD, how it comes on, why it comes on, it is completely related to smoking in our society. By and large, in this country, if you did not smoke, you do not really develop what we think of classically as COPD emphysema. Now, there are a subset of people who suffer from chronic lung disease over long periods of time that's not managed well and not appropriately taken care of, and those folks can progress to a chronic obstruction of the lung, COPD being chronic obstructive pulmonary disease. But the vast majority of folks we think of as COPD, it's smoking induced. When you quit smoking, you don't gain back the function of the lung that you lost, but your rate of decline in lung function goes back to the normal rate of decline that occurs in everybody over time. I've seen folks who are unable to get off cigarettes who have been able to get off heroin or methamphetamine, and they just cannot get off that last thing, cigarettes. I mean, these things are engineered to be highly, highly addictive. And so unfortunately, I think a lot of these folks are victims to that culture that they grew up in. Certainly the incidence of new smokers is declining over time, good public policy, good education. But a lot of the things that we're dealing with now are a function of the damage that's done to folks over decades. You know, we speak about COPD, the other big one is lung cancer. Unfortunately, it's another one of those disease processes that's almost exclusively linked to smoking history. Now, that's not to say that folks who don't smoke cannot develop it. There are other exposures. Of course, family history is important, but by and large, the primary risk factor that is associated with the development of lung cancer is smoke, including secondhand smoke exposure to a lower degree. Just like we think about breast cancer and getting a mammogram, just like we think of colon cancer and getting colonoscopy, there are in fact recommendations for folks who have smoked to go get low-dose CT scans yearly. The USPTF actually just recently changed the recommendation to folks who have been smoking more than 20 pack years, meaning an average of a pack per day over 20 years, or any other way to kind of add up to that average. And those folks are actually recommended, if they are active smokers who have smoked within 15 years, they should be getting CAT scans every year, something that's very underappreciated. And like all screening programs, the point of a screening program is to prevent progression and to be able to intervene in that disease process early enough to save someone's life.
There are ways to avoid having to visit a pulmonary specialist.
The advice I would give to folks to avoid ever having to see me in the office is just do those things that make sense to you logically in terms of staying healthy. Exercise, eat well, be active, don't let your body fall into disuse, avoid smoking. I think if you avoid those few things, the chance of you ever having to see me as a specialist is minimal.